Okay, hi everybody, I'm Chris, and I just want to talk a little bit about how we are accountable to make sure we're doing everything we can to save our lines. And one of the tools that I think is helpful is when you do handoff, that you discuss the status of your line with your coworkers. And this is something that you can do. It'll take you about 20 seconds extra to review the key takeaways that meet the CDC guidelines. So when I'm handing off to my friend Teresa, this is what I'm going to tell her to give her all the information she needs to be able to manage that line for the next 12 hours. First of all, I'm going to discuss whether I still need this patient. And we're going to pretend our patient has a right IJ. I'm going to tell Teresa the reason we still need these lines. We're getting long-term antibiotics, we're giving Vanco, we need frequent lab tests. The next thing we're going to talk about is the dressing dry and intact. We're going to make sure that it's dated and labeled. We're going to palpate our site to make sure that there's no tenderness around it. The next thing we're going to look at is to make sure that the primary and secondary tubing are dated and labeled according to our 96 hours change dates. We're going to discuss what is infusing in our lines. We're giving Vanco, or we're giving sedation, or whatever we need to get in the lines. And the final thing is to make sure that we know the line is functioning the way it's meant to be. We're going to discuss whether each lumen has brisk blood return and can easily flush. And if you cover all these things, we have all the tools that we need when we take ownership of that line for the next 12 hours to manage it. So if there's any changes in your line, you're going to know that you need to troubleshoot the line, and possibly if you don't have a blood return or it's sluggish, you need to consider whether or not you need to get the order for active ACE. So remember, our goal is to be proactive, not reactive. Is that okay?